I'm a little confused. We have some amendments that are out here, and I'm not sure whether those will come up later. But with the opportunity that they might not, since this is a strike after amendment, I'd like to address some of the things that we put forth. One of those things is that we've talked about earlier is that is child care and the eligibility. And I don't see anything in this amendment that would address child care eligibility. 23% of the residents have a child care desert. And that might not mean much to all of us, but it really does when you're a parent with children and you're wanting to go to work. It's also important when you're an employer and you don't have that resource there of having people to be employed. And this is no small chunk of change. We're talking, $10,000 a year. That's, wow. I don't know about you, but that'd be a big chunk out of my budget. And it is out of families that have children going off to daycare, and the eligibility impacts a lot of those. I think it's a modest investment we could make and make a huge difference in the lives of children and families. The other thing that I really, we talk about work groups, and we've had work groups on many different things. I know there's children's mental health and all those other wonderful things that we've been working on. But Department of Human Services and Public Health, as you're aware, Senator Costello, had recommendations on the work group that met last summer and fall. And two of their key recommendations were, I think, impressive and very good, and I believe we should have adopted in here is the Department of Public Health's integrated provider network should be reimbursed at the same enhanced community mental health rate. It's a fair way of looking at things. It's really a small investment to get those 11 providers who treat Iowans with addictions up to where they should be. And secondly, we think that Iowa Department of Public Health and DHS should work together to look into applying for that Medicaid waiver reimbursement for residential and intensive outpatient treatment services. And we talked about it. I know we were in a group where they discussed it, and it really would be important because they're seeing it in other states, and it's really a successful project and actually saves money. They're talking about millions of dollars that they're saving. So I think that is really something we should have addressed in this strike after. And one of the other things that, I don't know, I think all of you have nursing homes in your area, and I know I have quite a few in mine, and they have certainly pummeled me with emails saying how important that the reimbursement rate that the House put in there, how important that rebasing was, because when you're struggling in the increasing amount of people with Medicaid, and I look around this room and around the state, we're a graying state in many ways. I, of course, have not got there yet, but there are many of us that, are looking at a whole group of individuals that are headed in that baby boomer, range, and that's going to have an impact on the care facilities even more than what they're experiencing now. And at the end of the day, that goes beyond, Medicaid. It impacts the private pay individuals, so they're having to adjust their rates. And I look around and say, wow, those are good employers, good people working in a very difficult situation, and we need to make sure that we're taking care of them as we move forward. So I may have some more comments later on this, but I encourage any of my other members who have issues to discuss them with Senator Costello.
The chair recognizes the senator from Johnson, Senator Bolkcom.
Well, thank you, Mr. President. Mr. President, ladies and gentlemen of the Senate, I rise to discuss one of the provisions in the bill that I have really grave concerns about. And we've heard about transparency and truth and accountability in this room for the last week on things like property taxes. And I don't remember Senator Costello talking about this particular provision that is a life and death provision in this bill, and I hope he'll address it. But I want to talk about the transgender community members this afternoon. and I want to talk about their medical and emotional health and well-being, which is under attack in this bill. Our transgender community members are our neighbors, friends, sons, daughters, co-workers. They are Iowans. They are human beings. They deserve our respect, just like every single senator in this bill targets coverage for their essential and necessary medical treatments. It's ignorant. It's discrimination of the worst kind. It's a clear violation of the equal protection under the Iowa Constitution. And I hope somebody on your side has the guts to explain to us this afternoon why this language is in this bill. People seeking surgical treatment for gender dysphoria are seeking medically necessary care supported by medical science. The American Medical Association, the American Psychological Association, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists all support this view that medically necessary care is needed. And they believe that these medical procedures should be covered under public insurance programs. And here's why this is important. Here's what's at stake. Unlike elective cosmetic surgery that a person undergoes for aesthetic reasons, medically necessary gender-affirming surgery is intended to alter a person's body to conform with the person's gender identity in order to address the life-altering and at times life-threatening consequences of gender dysphoria. The undisputed medical evidence shows that gender-affirming surgical treatment may prevent social dysfunction, physical pain, and even death. If left untreated, gender dysphoria often causes acute distress and isolation, impedes healthy personal development and interpersonal relationship, and destroys a person's ability to function effectively in daily life. Why we would want to prevent somebody from getting the medical care they need to function effectively in daily life, I have no understanding of. Suicide and death are common among persons who are unable to access gender dysphoria treatment, with an attempted suicide rate of 41 to 43% for those individuals, 41 to 43% for those transgendered individuals, compared to a baseline rate of about 5% for everybody in this room. Everybody in this room that we are not aware of transgender, that is. The language on medically necessary care for Iowans needs to leave this bill. We need, transgendered Iowans need this coverage. And the language in this bill is cruel. I think it's ignorant. It doesn't understand the science. And it discriminates against Iowans already marginalized. Again, does anybody on your side have the guts to explain why this language is here? I will yield right now. If I see a hand, Senator Costello, would you yield?
Yes.
Senator Costello, will you yield?
Yes.
You're in order, Senator.
Senator, can you tell me what the thinking is on why this language is in this bill this afternoon?
Okay. Well, as you probably know, this language was in administrative code has been for years, and it was always practiced that way. A recent court case was decided that changed and said, no, that doesn't count. You are forced to provide those surgeries. So we're changing the policy back to they are forced to. Now, as you know, there's a pretty expensive surgery. I don't know that I agree with you that it is always medically necessary, which is what Medicaid is about. So we're just taking the code that it was and saying that no, it's going to be this way it has been prior to this this court decision, and I think a lot of people might have trouble paying for this type of surgery, thinking that's not maybe a proper use of federal or of our state monies. So we're just trying to react to the lawsuit that came up.
Thank you, Senator. People that are prepared to end their lives, people that are not able to function in their lives, deserve to have the medical care they think they need. We don't say to somebody, we spend a lot of time talking about mental health here. We're spending several $100 million on it. If this isn't a mental health issue for transgendered Iowans to not be able to be who they are and get the medical care they need, what could be more important than that? We all say we support people with mental health problems. We have a 10 times greater rate of suicide among transgendered Iowans than your average Iowan. The cost issue, I've gotten some information on the costs. We don't ask when somebody has cancer, geez, what's that going to cost? Well, that's too much. We don't ask when somebody needs help and they go to Independence or one of our institutes that provides care that's costly. We don't say, well, that's too much. So I don't like the idea, Senator Costello, that suddenly for transgendered Iowans, we've got a cost test. We've got a cost test. And I don't know what it is. The data I've got from one of our medical institutions ranges anywhere from, for out-of-pocket costs, anywhere from $5,000 to $30,000 of the cost of the patient. And there's a whole variety of things people might elect to do that they might medically elect to do. So the notion of cost, I think, is a phony argument. I mean, it may be where you hang your hat. We should, if we're going to go down that road, though, we probably better start talking about some other things that we pay for that cause people death in this state that might just be too expensive. We just can't afford it. Republicans just can't afford it anymore. We've got to put the cost test to it. Because I think that at the end of the day, this is a matter of life and death for people. Gender dysphoria is a serious medical condition that requires surgical treatment for those people that elect that. And it's essentially, I believe, medically necessary for those transgendered Iowans. And at the end of the day, this is not Iowan. We take care of people in this state. It's a very small group of people, actually, that might seek this kind of medical care. We can afford it. It's the right thing to do. It shouldn't be in this bill. We didn't need to have this in the bill because of that court case. I reject this amendment. This is unnecessary. We are better than this. Thank you, Mr. President.
The chair recognizes the senator from Linn, Senator Mathis.
Thank you, Mr. President. Mr. President and Senate colleagues, when the governor gave her State of the State address earlier this year, she talked about the need to fix the parts of managed care that were broken. She pledged to us that she would work on that. And I had hoped that in this bill, Senator Costello, that we would see some real changes to managed care, that we would see some fixes to managed care. And you know, as well as I do, that there are some things that are still broken and things that we could change this session, but we are not doing them. They're not addressed in this bill, such as supported community living. Do most of you know what supported community living is? Well, for today, I'm just going to explain it so that you'll know what it is and what we're not fixing. And then when you go back home and somebody asks you about it, why you didn't do something about it, at least you'll know what they're talking about. So I'm going to take you on a little history trip. So when Harry Truman watched LBJ sign the Medicare Medicaid bill back in 1965, which was a bipartisan effort, hard to believe that now, that when he signed it, he said, "It calls upon us never to be indifferent toward despair. It commands us never to turn away from the helplessness. It directs us never to ignore or to spurn those who suffer unintended in a land that is bursting with abundance. And I think you'll all agree we're pretty lucky to be here, but not everybody can be here, so we're their voice. So the helpless live among us. Disabled Iowans, such as a Down syndrome adult, I'll use that as an example, who use transportation to get to their jobs and to get to day services. So this is particularly about transportation. Before managed care, the supported community living transportation waiver helped people get to their jobs and to get to different medically necessary appointments and get to day services. But when managed care entered the state, the waiver was eliminated, and it was replaced with a tiered rate system that was intended to be cost neutral. So as DHS explained it to us, it was cost neutral. I think everybody was just cautious about what was going to happen. It sounded okay on paper. In theory, it sounded all right. So now, this is how it works. The managed care organization does an assessment on each Medicaid member and then decides what tier they're in to qualify for transportation services. The problem, however, is hourly and cost reductions that have forced people who need our help the most to look for other ways to get to work or to get to those day services. In a letter dated November 2nd, 2017, DHS said that this new tiered rate system would, quote, better align reimbursement rates to each member's need for supports and services. Great on paper, right? Great on paper. But it hasn't. Transportation providers see that the managed care organizations are assessing their clients to get fewer services in order for the MCOs to save money, your taxpayer money. And payments are delayed or refused. Many of the complaints I get are about this very thing. So according to an investigation just last fall, this was I think in October or November, by the Des Moines Register, this change has forced transportation groups like DART in Des Moines, we have several people who live in Des Moines here who are representing Des Moines, Riverbend Transit in Davenport, Senator Smith, Link Associates in West Des Moines, Candio in Johnston, Crest Services in Des Moines, and Heart of Iowa Regional Transit Agency, which serves 7 central Iowa counties, including Story and Warren, to cut back, lose money, and lay off staff. Have you ever played Jenga? You know, that block game where you put a block in, and then you pull it out and the whole thing falls out, right? Well, that's kind of what's happening here. The transportation infrastructure has been affected, which in turn distresses services for the state's most needy, the people we have pledged as elected leaders to help. We need to do something here. This amendment before you, or it was going to be an amendment, but it isn't, but what I'm talking about is that the Department of Human Services should review this reimbursement paid under the new tiered rate system and better determine what is an actual and reasonable cost of service. We would hope that in this bill, we would have asked for a review that will make sure that these costs aren't shifted onto property tax owners. Because right now, DART in Des Moines is saying if they're not reimbursed for the real costs of transportation, they're going to shift that cost to make up for the losses to property tax owners, owners of property, and it will be taken out of your property tax or increased. So I would ask you to think this through. I know you probably won't change it. I'm sure you won't talk to the House about it. But it's good to be aware that when you go back home and you're asked about this, that you tell the truth. That you didn't put it in the bill because you didn't think it was important. There's another thing, too. So this is about external review on claims that are rejected in managed care. As you might know, or maybe not, U.S. Senator Bob Casey has asked the U.S. Inspector General to open up an investigation into managed care across several states in the United States. And what they're focusing on is prior authorization and denial of services. Iowa's included in that investigation. Our appeal process is limited when it comes to pre-authorization, authorization, and denial of those services. That's where we see most of the complaints. And so now we're under investigation. This bill could have asked for external review. We could have said to the Inspector General, this is what we're doing to alleviate this issue. This is what we think is the problem. And in reviewing it, we do see that it's a problem where claims are not being paid. Millions of dollars of claims are still not being paid. And that's the truth. That is the truth. Ask Link Associates. Ask any provider. Ask the hospitals. The claims still are not being paid. So in an appeal process right now, yeah, you can file a grievance. It takes time. You can file an appeal. But the MCOs decide what they want to do in that grievance. The MCOs decide what the outcome of the appeal will be. Then it goes to a fair hearing board, state fair hearing board. But guess who decides? DHS. That's who decides. We need a fair external review instead of somebody taking their case all the way to district court. And it costs a lot of money, which they don't have. And if they don't have the money, they can't fight for it. So we've seen cases go to court on wheelchairs. And as I stood up on the floor last year, on bowel care. Somebody went to court over that, over services. So we did have an opportunity, but we chose not to take it. And when the governor said in her speech that she was going to fix some bumps in managed care, we all stood up and applauded. Great, yay. What happened? Nothing. We had an opportunity and we didn't do anything. Thank you for listening.
The chair recognizes the senator from Polk, Senator Celsi.
Thank you, Mr. President. This bill and the amendment takes out some very important funding to some pregnancy prevention programs here in Iowa that are just extremely important. I am the mother of 2 daughters who are now in their 20s. When they were 10 or 12, I talked to them about sex education. I started talking to them about things that would be happening to their bodies, things that would be happening to them as they got older, experiences that they would probably have, and we opened up a great line of communication. I was really proud of those conversations. However, a lot of their friends that came to my house in the next, say 7, 8, 10 years did not have the parents in their home that were having the same conversations with them. So I would have the talk with them too. And their eyes would get wide and they would ask questions and they would come back later and ask more questions. At the end of every single one of those conversations, I always said to them, there's an organization here in Iowa called Planned Parenthood that you can call to get more answers to your questions. If you're ever embarrassed to ask me a question, if you ever need more information, you can always call them and they will help you.
And guess what? That turned out to be true. Both of them ended up calling them and asking questions and didn't tell me about it until many years later, which was fine with me. Because Planned Parenthood and other groups like Planned Parenthood in Iowa know what they're doing because they have years and years of experience. There's two particular programs called the Personal Responsibility Education Program and the Community Adolescent Pregnancy Prevention and Services Program that provide this much needed information to young people while they're in school. And some church groups are doing this too. And it's medically accurate information that all young people need to make good decisions in their lives. And I'm sure you'll notice one of the programs was named Personal Responsibility Education Program, because it is a personal responsibility of each human being to know about their own body, to know how it works, to know about sexuality, to be able to take care of themselves and their future family, and their life and their education and their financial future. That's why these programs exist. I'm just going to use one example from the results of this program. Between 2013 and 2017, in one county, Dallas County, there was a 37.1% reduction in teen pregnancy. That's astonishing, 37.1%. During that time, there were classes, like I mentioned, in Waukee, Perry, Van Meter, and other communities in Dallas County. It's no coincidence that these numbers are what they are. These programs prevent abortion from happening. We all want fewer abortions. I think that is a good goal for this body to have. Using these programs in schools causes less abortions to happen. I'm very disappointed that this language ended up in this amendment because no one got a chance to talk about any of this. No subcommittee, no committee, no public hearing, no nothing. The last day of the session, we get this dumped on us. It's unfair to Iowa's young people. It's unfair to your colleagues. And I urge everyone in this chamber to please consider this information and vote no. Thank you, Mr. President.
The chair recognizes the senator from Dubuque, Senator Jochum.
Thank you, Mr. President. Mr. President, members of the Senate. Yesterday, we spent a great deal of time talking about transparency for local governments. We talked a little bit about truth in taxation, okay? But what about truth in budgeting? What about the transparency in our budgeting process? We all know that the amendment before us is a double-barreled effort to make sure that the numerous amendments that we have introduced today to try and address some of the real problems that we see in the Health and Human Service budget get addressed. And we all know that once 3247 is adopted, the president's going to rule all of our amendments out of order. I get it. I will say I never remember a time that I've been in the Senate that we ever double-barreled. You have the right to do it. You have the power. You can abuse it if you want. You can step on the minority. That is certainly your right to do that. So today I'm going to talk a little bit about one thing that some of us have talked about for several years now. And before I do that, I would like to know if Senator Costello would yield to a few questions.
Senator Costello, will you yield? You're in order, Senator Jochum.
Thank you, Mr. President. Thank you, Senator Costello. Senator Costello, does your amendment eliminate expedited claim disputes processes for outstanding claims for any of the managed care organizations that are leaving the state of Iowa, specifically United Health, and of course, AmeriHealth Caritas.
Okay, thanks for asking that question. We did have that in the earlier bill, and as we got to looking into that, we became concerned that it would open up the contract with United and cause a lot more disputes. Now, we have some ways of dealing with that. We can withhold a fairly large amount of money until we're satisfied that they've paid all the claims that they need to. It's a little unfortunate we couldn't do that. We wanted to, but in the end, it didn't seem to be a wise thing to do because of causing more.
And what about AmeriHealth Caritas? Have they paid all their bills? They've been gone, 8, 9, 10 months. Have they paid all of our local providers what they were owed yet?
All right, so there are still some
outstanding bills.
There are outstanding bills that are maybe being disputed as well. But I would point out that we still have quite a bit of their money, more than what they owe there. So when that gets resolved, I believe we'll still.
What about? Thank you. I appreciate it. Another question. Anything in here to address conflict-free, independent case management?
I don't believe we have anything.
Okay. What about holding the MCOs accountable in terms of making sure that they have some kind of universal prior authorizations so that our local providers aren't jumping through a gazillion loopholes all the time when they're trying to file their billings to get paid?
Yes, we actually do have that.
So there is some universal prior authorization language where all the MCOs are going to use the same. Okay, very good.
We're working toward that, yes.
Terrific.
Please state your point.
Under the rules of Mason's manual, the senator can ask a question but has to give the opportunity for the senator to respond without interrupting the senator.
I appreciate that.
Senator Chapman, Senator Jochum, will you please approach the well? Senator, the chair recognizes the senator from, first of all, Senator Chapman, your point was well taken. The chair recognizes the senator from Polk, Senator Petersen.
Thank you, Mr. President. Democrats will caucus.
The Senate will be at ease for Democrats to caucus.
Democratic caucus in room 24 starting immediately. Democratic caucus room 24 starting immediately.
The Senate will be in order. There is business in the well. The Secretary will read.
House has on April 26, 2019, passed the following bills. Senate File 603, a bill for enacting authorizing the use of concurrent enrollment programs for teaching certain subjects required under the Education Standards, making appropriation to fund enrollment of pupils under a concurrent enrollment program agreement between accredited non-public schools, community colleges, including retroactive applicable divisions. House File 760, bill for enacting the exemption from hotel motel taxes for the renting of lodging.
When we recessed, Senator Jochum was making comments on Amendment 3247 to Amendment 3201 to House File 766. So we will return to Senator Jochum.
Thank you, Mr. President, and thank you, Senator Costello, for attempting to answer some of my questions. So let me start over. April 1st, the third anniversary of privatization of Medicaid in the state of Iowa. And I hate to keep walking down memory lane here, but it was a unilateral decision by Governors Branstad and then Lieutenant Governor Reynolds. Legislature wasn't involved, our providers weren't involved, and many of the people the system was designed to serve and help were not involved. So what's happened? We're one of two states that, in my humble opinion, dumped 600,000 Iowans all at one time into an entirely new system. Over the objections of many of us who asked a couple things. Number one, not to do it at all. That was rejected. When that was rejected, we then asked whether or not we could carve out the long-term supports and services population. That was rejected. And then we asked if we would phase in the populations over an 18 to 24-month period to give the system time to adjust. And that was rejected. So here we are, 3 years and almost a month later, and have we solved the problems, at least among the disabilities community? Members, that is the one group of Iowans that we consistently hear from because their services have been cut, and many of our local providers who provide those services have not been paid timely, some not paid at all, and many at a rate less than what they were paid prior to privatization. So let me just give you an example of just one person whose mother sent me a letter to illustrate that this is far from being solved, far from being a better system that improves the health outcomes of Iowans with disabilities. Kim was a victim of an auto accident in 1981 at the age of 16. She sustained a traumatic brain injury. She was in a coma for 3 months. She survived. Needless to say, she has physical, mental, and emotional deficits, and for the past 34 years, we have dealt with the issues on a daily basis. Kim's case manager supported and advocated for her and our family. There were no major issues until 2016 when managed care took over. The first thing AmeriHealth did was cut her monthly budget by 47%. We, her family, started paying an average of $3,000 out of pocket every month. It took time, but we were finally granted a state fair hearing. Judge Laura Lockhart ruled in Kim's favor that she should be on the exception to policy and her original budget reinstated. She also said it was the MCO's responsibility to create a care plan equal to or better than Kim has had at no cost to her family. There were 2 state hearings with AmeriHealth. They were both ruled in Kim's favor. We were able to recoup not all, but some of our out-of-pocket expenses. Then AmeriHealth left. And during the transition period, Kim was put back on Iowa Medicaid under the fee-for-service. My daughter was as well. Jerry Foxhoven approved Kim for fee for service, her original budget reinstated, and then Amerigroup took over in, of course, March. They knocked Kim's budget back down to the 53% rate, and we have not been granted a state fair hearing, as Amerigroup denied the ETP and said it was not appealable. Mr. Foxhoven supported that decision, and consequently, we are again paying $3,000 a month out of pocket. We are going broke. This is recent. I am still getting emails and phone calls and letters like this, members. I will ask you once again, can we carve this population out? It is where the vast majority of the problems sit with the Medicaid system. And it is not better. Health outcomes have not improved. There has not been an expansion of services at the local level. If anything, we have fewer. For those that many of us would consider the least among us. Now, my daughter may not be with us anymore, but this is one mother who will never back down from defending the most vulnerable among us. Never will I back down. And I am pleading with all of you to start listening to this and doing something that will really make a difference in the lives of those in our society. Because we will be judged. We will be judged by how we have cared for them.
The chair recognizes the senator from Johnson, Senator Kinney.
Thank you, Mr. President. I want to stand today to speak about education, sex education, and how very important it is, and the restricting of services or funding to Planned Parenthood, how that can affect a young person. The education that they receive give them the words to report to law enforcement. Give them the words and the comfort to be able to talk knowledgeably with a law enforcement officer when they are reporting a sexual assault, when they are reporting that they have been trafficked, when they are reporting that they have been abused. We need to give them the knowledge so they can stand up for themselves. And by restricting the funding to Planned Parenthood to teach our children this, to me, it's on us. The services that Planned Parenthood have provided to these young people are a very valuable service, and I ask that you consider allowing Planned Parenthood to be funded so they can teach our children. Thank you.
The chair recognizes the senator from Polk, Senator Bolton.
Thank you, Mr. President. I want to echo some of Senator Kinney's remarks on sexual education and what this legislation does. There's language in this amendment that will shut down one of the most successful community adolescent pregnancy prevention, or CAP, programs, as well as personal responsibility education programming, and the things that they have done to improve sex education in Iowa, programs that Planned Parenthood has been able to use, as Senator Celsi pointed out, to dramatically reduce teenage pregnancies. These are programs that are working in our communities. In Polk County, the county that Senator Celsi and I represent, we're talking about a reduction in teen pregnancies by over 20%. over 20% reduction. That's a very positive impact in our community that these programs have had. One of the programs, a prep education program called the Wise Guys Male Responsibility Curriculum, focuses on sexual health for young men. It's about education about sexually transmitted infections like HIV. It's about addressing the consequences of teen pregnancy and early parenthood, and it helps young men understand the risks and responsibilities of being sexually active at early ages. These programs are working and should not be abandoned simply because of a bias against the organization that is putting them on. They're working and we need to support them, not inhibit them. The other thing I want to mention is an amendment that I have scheduled to come up that will likely be out of order after this amendment's adopted, about our Department of Human Services facilities in this state. We've had some real tragedies happening in Iowa, particularly as we saw in the news recently at Glenwood, seeing a startling increase in deaths at that facility. 14 since last June. We've heard, several of us, from employees at our mental health institutes, their concerns on staffing level, on increases in injuries, on continued work hours being stretched further and further. There are concerns about safety of the employees as well as the patients. My amendment was going to call for an investigation, a real review of DHS facilities, of DHS staffing, of DHS programs at those facilities to make sure we're doing everything we can to take care of every person entrusted in DHS care, as well as the individuals who are there every day providing that care. The people who are there that put in a full workday over and over again to make sure people get the care they need. And unfortunately, at increasing rates, are putting their bodies on the line. They're overburdened, they're stressed, and they want to know we are paying attention to their concerns. Taking a look at what's going on in these facilities is something we need to do. It's our duty to protect Iowans. It's our duty to protect the people who work for our state to provide these services. We should be having that conversation. We should be making informed decisions. I'm disappointed that those two things are happening right now. We're taking away important reproductive health care programs and sex education programs. And then when it comes to taking care of citizens that we need to take our responsibility seriously with, we're not going to find out what's going on. That's disappointing. I hope we can reject this amendment and have the conversations that we have heard introduced from my fellow senators who think there are a lot of things we can do to take care of our citizens a lot better in this state. Thank you.
The chair recognizes the senator from Polk, Senator Petersen.
Thank you, Mr. President. This HHS budget is a failure to our fellow Iowans. And it's hard for me to listen to Senator Jochum knowing how this fails Iowans like her daughter, Sarah. And this budget also fails women in this state who are pregnant. In less than 3 years' time, the maternal mortality rate in our state has more than doubled. We've lost 49 young moms in the past 3 years. I don't like the process that you're using for this budget. A double barrel amendment on a budget bill this huge for the state of Iowa is simply wrong. We should be able to talk about individual components and bring our ideas to the table. That's what governing is about. All the talk of transparency went out the window when you plunked this on our desks. I had an amendment that would take a look at how Medicaid is reimbursing for labor and delivery in our state. Because as many of you have heard me say time and time again, we lost 8 labor and delivery departments just last year alone. We had 40 women lose their uterus while delivering babies at one hospital in the last 24 months. I sent information to every senator in this chamber about the crisis that we're facing with the lack of health care providers for women who want to have healthy pregnancies. It is unsafe for women to have to drive 2.5 hours to find a hospital that has the services to safely deliver babies in this state. But because you're double-barreling this amendment, my amendment will be ruled out of order, and we'll continue to see more women and more babies die before we're able to address this issue. I also want to say I think that this takes civil rights backwards in our state for so many people, people with disabilities, or children, women. I want my kids to be able to have access to sex education that's medically accurate and appropriate for whatever age they are. I want them to know that they're loved no matter what their sexuality is, and that they live in a state that would embrace them and give them the health care that they need. This is a program that actually prevents abortions, and I don't know why you're targeting Planned Parenthood. Planned Parenthood prevents abortions. Planned Parenthood doesn't get to write the curriculum on this program. In order to receive the funds, participants have to choose from a set of curricula. If there's any deviation from the curricula provided, it must be documented. The curriculum must be evidence-based and medically accurate. If you want to review it, the department can provide it. If this was such an important issue, why did you not go through the committee process? Why is Planned Parenthood the only organization being cut off? Senator Costello, would you yield to a question?
Senator Costello, will you yield? You're in order, Senator.
Senator Costello, could you explain why you're targeting only one organization by cutting off Planned Parenthood from the program?
We are not targeting Planned Parenthood by name, but the fact that they provide abortions is the criteria that we're setting up to not be able to participate in this program.
If I read correctly, it looks like Unity Point is being allowed to participate in the program.
I believe that's correct, yes.
Would University of Iowa hospitals and clinics be allowed to participate in the program?
I'm not so sure about that one. Do we know? No. I don't think so.
Why would you not let University of Iowa hospitals and clinics participate in the program?
Well, again, it's the abortion issue. We don't feel that the people of Iowa should be required to do business with people that provide abortions and have the...
Do you think that senators should be allowed to get their health care from University of Iowa hospitals and clinics?
Yes, that's their choice.
Is it taxpayer-funded health insurance that senators use?
What we get paid is what we are paid for what we do our job. It's different than Medicaid.
No,
Then when it's a government grant or something like that. We can do that because we are paid that money. We are provide that. This is a little, I'm kind of winging it here a little bit.
I understand what you're saying.
Can I finish, please?
Yes, you may.
Just because I want to make sure I make my statement. There's a difference between when we have government paying for something whereas our salaries are from the government, but it's not like it's a government grant or something that is a charitable type thing.
Well, the last I understood, health insurance that we receive is also paid by taxpayers, correct?
That's correct.
So basically, you are using Iowa children to make a political statement by denying them access to a health care provider that you yourself could go to on taxpayer dollars, but you are going to deny them the opportunity of having trained medical professionals teach them about sex education. That is simply wrong.
Can I reply to that? Yeah. So just so everyone understands this program, it is not the regular sex ed that we have in school. This is a special program that's targeted to areas where we feel there's a need, and we're not eliminating the program. The program will continue. Different people will provide the programs in these 4 cases where Planned Parenthood currently has 4 contracts.
All right, thank you for that clarification. I want to clarify a little bit further because I think when we had Senate File 2 a few years ago, we talked about getting increased access for a program. What we found, we actually got the 70% decrease in access. And if you look at the organizations that applied to participate, in several of these areas, there were no other organizations that applied to participate. In addition, kids don't stay the same age forever. Every day they grow older. And if this goes into effect, the state will have to reissue another RFP and wait. And in the meantime, kids will not be able to receive the service. Not only that, every other organization that had applied will also have to wait, putting their own organizations at risk. Most importantly, you're putting politics ahead of public health. And that's simply exactly what you're doing with this. Would Senator Edler yield?
Senator Edler, will you yield?
Yes, I would.
You're in order, Senator.
Senator Edler, you spent a great deal of time talking about the children's mental health governance structure, and it was my understanding that you were going to secure money for Iowa children to have those regional children's mental health experts, and it looks like $700,000 that was set aside for children's mental health got ousted in this budget.
That is correct, but we do still have a large amount of money that will indirectly or directly still be going to the Children's Mental Health Initiative.
In what capacity?
Well, the rural psychiatric residency, psychiatric training, money to specialty care, Your Life Iowa, IT projects through DHS upgrades, eliminating the children's HCBS waiver, ACT team reimbursements will eventually get there, on down the line.
Where are the regions supposed to get the funding to pay for the child?
They will have to use their levying authority to pay for that position this year.
And did you change their levy authority?
They have the levy capacity in almost all of the regions to cover that position.
Almost all?
Well,
which ones
actually,
don't?
Polk and Scott are the 2 areas, or eastern Iowa.
So what are they to use?
They're going to have to prioritize with their money, just like my family does.
And when was the last time the levy changed for those counties?
The last time it changed, I believe it was capped at was it 3028 or 3278 for Polk.
What year was that?
That was in 2017, I believe.
And when was the last time it was changed before that?
2013, back when the regions were done. Is that correct?
So are you saying that when you say that these regions will have to prioritize, you're now going to pit the children's mental health against the adult mental health program? Because they're not getting additional, if they're not getting additional funds, when you say they have to prioritize like your family.
Well, and we took the burden off of them through the elimination of the waivers. There's several areas of this that does provide them money to transition. How
much money will Polk County get for the children's mental health?
Polk County directly. I do not have it itemized by county. I've got lump sum dollars.
Thank you. This budget is a failure for children's mental health. There's nothing to restore the safety net for Iowa's children. You're making a political statement with our kids ages 10 to 19 with the PrEP program. I urge a no vote.
The chair recognizes the senator from Johnson, Senator Wahls.
Thank you very much, Mr. President. I rise today to urge a no vote to Amendment 3247. I rise in opposition for two key reasons, the first of which is the defunding of Planned Parenthood and the sex education program that it uses so effectively across the state. As a young person myself, I know that sex education is very important to young people all over Iowa. And I wanted to share a couple of the stories of young people who have benefited from this program and what they have to say about the services that Planned Parenthood has made available and why this educational program is so important for them and for their futures. From Nicole here in Des Moines, teenagers need good information to protect themselves. Planned Parenthood kept me from becoming a teenage mother by educating me and providing contraceptive services. Planned Parenthood is the reason I can give my children a good life as an adult. In Anthony, Iowa, I have twin teenage girls. Without sex ed and Planned Parenthood, my daughters would not be educated on sex, pregnancy, sexually transmitted diseases, healthy relationships, or ways to avoid pregnancy. These are all important to keeping these girls healthy physically and emotionally. Due to the current funding and programs available, my girls are much more educated, and I'm able to help them to grow while making healthy choices. Sydney in Urbandale says, because effective sex education is the cornerstone for so many important conversations, including pregnancy and STD prevention, body basics, orientation and identity, consent, boundary setting, respect and communication, online safety, the list goes on. These are the empowering conversations that I wish I would have received and would have highly benefited from during my middle school and high school years. Our next generations deserve more. Anna in Eagle Grove, Iowa says, when I was 14 years old, there was a girl in my high school who was coerced into sex. She had no idea what an unhealthy relationship looked like or how to get help out of that relationship. She also had no idea how to prevent the pregnancy that happened as a result, as we grew up in a very conservative area. If she had known, she would have had the tools to protect herself from pregnancy and would likely be in college today instead of struggling as a single parent with a minimum wage job. Deborah in Cedar Rapids says, children and youth need to know what behavior is risky and what is safe. Simply telling them not to do something is not going to prevent STIs or unwanted pregnancies. They need to have the mystery removed so sex can be understood, both the good and the bad. Just telling a teenager don't do it is the fastest way to get them to do something. Jill in Indianola says knowledge is power. It's important to me that my kids know as much as possible about their bodies, puberty, and sex. We do a huge disservice to future generations by giving body parts cutesy names and refusing to explain the positives and negatives about sex in our bodies. Sex shouldn't be embarrassing and shameful. It's normal and can be amazing and rewarding, especially when you have been given the tools and vocabulary to discuss it in the most safe and healthy way possible. In Ames, I grew up in a state with a great sexual education, but when I went to another state for college, surrounded by people from all over, I learned that my education was not normal. Teaching abstinence only creates a toxic environment for sex later on. It can also be very dangerous to have men in charge of making choices for women's health when they were taught nothing about it. Ignorance is no longer bliss when your male boss is upset that you can't shut off your period. I also received an open conversation and sexual talk from my parents, so when I was old enough for birth control, I was comfortable talking with them about it, while many of my friends were shamed and hid their sexual activity from their parents, or were so afraid that they would get caught with it that they didn't use protection at all and suffered the consequences. And Emily in Ankeny says, I was required to take geometry, but I wasn't even offered sex ed. Guess which one was more relevant to my adult life? Pretty easy guess. I think the reality is that the defunding of this program is a clear and direct assault on sexual education in our state. But the reality is that all people who are young and who are facing these choices for the first time deserve an education, and they deserve the health care that they need to stay healthy and to plan for their future. My concern is that by defunding this program, we're going to have students who would in other situations have the opportunity to get this education who are not going to get it, because Planned Parenthood is such an effective deliverer of these programs. I'm also rising in opposition today because of the changes to the Iowa Civil Rights Code that we can find in Division 20 on pages 96. These are very concerning to me for at least 3 reasons. The first of which has to do with the medical necessity of the procedures that are being specifically singled out by this passage. People who are transgender don't undergo a transition because it's fun, or because it's easy, or because it's their idea of a good way to spend a Friday evening, like we're all doing here in this chamber. People go through a transition because it's medically necessary. It's incredibly difficult to go through a life-altering phase where you're facing not just changes of your body, where you're talking about surgery, you're talking about new hormones in your body. This isn't easy. Talk to a transgender person who's actually gone through this process. Any of them can tell you how difficult and how trying this period can be, especially if they don't have support from their friends, family, community, and employer. The language in this section, I think, clearly communicates a lack of understanding about the realities that trans people face in our state, across the country, and across the world. I'm also very concerned about the effect that the passage of this code section will have on Iowa's standing within the business community. It was just a couple of weeks ago that we were finally able to host some rounds of the NCAA basketball tournament here in Des Moines. I didn't have a chance to attend a game, but I know that people came from across the state and across the region to attend this tournament, to have a good time. And we know that there are states that have started rolling back their civil rights laws that have faced strict sanction from organizations like the NCAA. And I want to stress that the sanction is not because of some kind of vendetta. It's because these organizations know that they don't want to do business in a state that does not value civil rights. And that is the code section that we are amending with this amendment. And that is absolutely what is up for the vote when we go to vote on this amendment. My final concern is about equal protection and the way that this part of this amendment is targeting a vulnerable group of people who, like every Iowan, benefits from equal protection. So, Senator Costello, will you please yield?
Senator Costello, will you yield?
Yes.
You're an order, Senator.
Thank you, Senator. I just have a couple of questions because I want to make sure that I have an understanding of how you think about transgender people when it comes to equal protection. Do you believe that transgender people should be treated equally?
Yes.
Yes, you do.
I don't see why we should treat them any differently than anyone else.
Do you believe that transgender people should be treated equally when it comes to their health care?
I think that's true, yeah.
You do believe that?
Yeah.
Do you believe that this amendment treats transgender people equally when it comes to their health care?
I'm not sure how to really look at it because it's something that no one else would want to have done. So I'm not sure how do you look at whether that's equal or not, Zach.
Okay.
Senator.
So you do believe that transgender people should be treated equally, and you believe that transgender people should be treated equally when it comes to their health care, but you're not sure if this amendment treats transgender people equally when it comes to their health care.
I think people can look at it different ways.
How do you look at it?
I think it's something that not everyone would want to do. So it's not there's certain things that someone else might want to have done that we wouldn't pay for either. Cosmetic surgeries, things like that.
And who do you think would want to have these surgeries?
I suppose someone who wants to change that are transgender.
People who are transgender would want to have these surgeries.
Yeah.
Okay. All right. Thank you very much, Senator Costello. Mr. President, I urge a no vote. I think that this amendment is going to have some devastatingly negative effects for the young people of our state. I think it is going to have devastating effects to transgender and intersex people in the state of Iowa. I think it is going to reduce Iowa's standing in the business community in our state and across the country. And I have grave concerns based on what we just heard about the Equal Protection Clause and how it will interact with this amendment if it becomes law. Thank you, Mr. President.
The chair recognizes the senator from Linn, Senator Mathis.
Thank you, Mr. President, for allowing me to stand a second time. Let's just get over this charade. You hear the words Planned Parenthood, and you run, you cut, you shut your minds off to whatever good they have done in your communities. You hear the words Planned Parenthood, and you think evil. Let's just stop the charade. You are targeting them. In this bill, you are targeting Planned Parenthood. That bothers me because of what they have done in my county. So we have a number of teen births in Linn County. Woodbury County has 604 births. They have 33% of them are teen births. Scott County is number 2. Polk County has 1,750 births. 24% of them are teen births. Linn County, 648 births. 18% are 62 young women are teen mothers. We have seen a huge reduction in the number of teen births. The numbers used to be higher. There's a young woman in Linn County who teaches education in several of our schools and around the area to teenagers. She talks about sex ed with them. So she writes, contrary to some misconceptions, abortion is not part of the curricula I teach. I do teach common forms of birth control. That is because all organizations that receive this grant funding must include information on family planning services. I am there to provide the facts in a non-judgmental way and to teach youth how to make decisions that align with their own values. Here are the facts about Planned Parenthood's impact in providing education. This is in Linn County. Last year, we provided 2,642 programs that reached 40,000 people. She facilitated 351 of those classes, reaching thousands of youth, in part as a result of Planned Parenthood's reach in increasing access to pregnancy prevention information. From 2013 to 2017, the teen birth rates dropped 20.3% and 37.1% in Polk and Dallas counties, respectively. Again, These are facts. They're contributing to access to information for teenagers. I don't know why we would refuse that. I don't know why we would reduce that, or why we would attack them for that by taking them out of this mix. They're reaching teenagers. They're doing good work. And you are punishing them. You're punishing them. When I looked through what Natalie had sent me, she also said, as Senator Petersen had said, this is research-based approach. This is a research-based approach. This is evidence-based. And she teaches everybody. Anyone involved in my classes can see what I teach, including parents and stakeholders. And I am required to turn in records of any changes I make to lesson plans. I just don't understand why we would target Planned Parenthood simply because you have issues about something else they do. Senator Costello, do you want to share what you've just said? Do you want to share with me what you are saying?
Senator Mathis, are you asking Senator Costello to yield?
Yes,
Senator
I'm asking.
Costello, will you yield?
I just felt when you said something else they do, when you're talking about abortion
Yes, I'm talking about abortion.
is not just something else. It's a terrible
It's a service they offer.
It's a terrible thing to those of us who view an unborn baby as a baby. And it's a little offensive to say something else they do. I'm sorry.
Thank you, Senator Costello. We all want abortions reduced. Every last person in the Senate wants to see abortions reduced. How do you think abortions are reduced? Birth control, sex education. That's how they are reduced. There's a program that's offered in Oregon and Washington. It's called One Question. And so when a woman walks into an OBGYN or their primary care physician, they ask them one question. Are you planning to have a baby this year? If the answer is yes, the woman is put on prenatal vitamins. There's a regimen, scheduled office visits. If the answer is no, there are suggestions for birth control, for healthy living, to make sure that there are regular STD checks. We have taken abortion and made that the focus of all of this, when what we should be doing is talking about how can we prevent pregnancies. That's the issue. Planned Parenthood helps prevent pregnancies and the work that they do in many communities in regard to sex education. I urge you to stop attacking them for the work that they do with young people around sex education and education around birth control. Thank you.
Seeing no further discussion, the chair recognizes the senator from Mills, Senator Costello, for final remarks on Amendment 3247 to Amendment 3201 to House File 766.
Thank you, Mr. President. I would just ask that we would move the amendment.
The senator from Mills moves the adoption of Amendment 3247 to Amendment 3201 to House File 766. Those in favor say yea. Yea. Those opposed say no. The yeas appear to have it. The yeas do have it. The amendment is adopted. With the adoption of Amendment 3247, all of the other amendments are out of order. That disposes of all the amendments to Amendment 3201. We are now back on Amendment 3201 as amended. Is there further discussion? Seeing none, the chair recognizes the senator from Johnson, Senator Bolkcom.
Let's go. Thank you, Mr. President. Mr. President, ladies and gentlemen, the Senate, I rise in opposition still to Senate Amendment 3201 and House File 766. Mr. President, you're fast on the draw today. Since we have a bill that was done in the back room.
Senator, you could have asked for a record roll call vote if you would have liked, or could have requested a division.
No, I was thinking between the roll call and more comments on the bill, it seemed to be pretty quick.
I saw your name light up, and I stopped mid-sentence.
Do we need to come down to the well, Mr. President?
Please. Senator Bolkcom, you're in order.
Thank you very much, Mr. President. I've been called to the well a number of times. This is, I think, the first time I've called myself to the well. Senator Zahn, you're correct. Since this bill was put together in the back room, and you have prevented us from offering any improving amendments to a really important bill, a couple $1 billion worth of spending, we offered amendments that aren't going to be debated. So there's a couple more ideas that were presented as amendments that I think we still want to remind you about, even though because this bill was done in the back room and popped out on us 4 or 5 hours ago, all we can do is talk about our concerns. So one of the amendments dealt with a problem that I think everybody's interested in, and that's better management of the state taxpayers' dollar. And we had a number of bills this session that focused on people that get public benefits from the state, especially Medicaid, and the notion that people on Medicaid, by God, they ought to work. And an amendment that was filed to this bill says for those people on the Iowa Health and Wellness Program, about 170,000 people, most of whom work, they work for somebody. And sometimes those employers don't provide insurance to their employees, right? So we framed the Medicaid Iowa Health and Wellness member as a freeloader. We need to track them down. We need to see what they're doing, why they're on Medicaid, and if they're not working, by God, they ought to have to report into work. But we really didn't get an opportunity to talk about the fact that we have an employer-based healthcare system where when you work for somebody full-time, there's some expectation that you're going to have health insurance, right? And there's 170,000 people in this state, most of whom who work on this Iowa Health and Wellness Program. And the amendment that I'm presenting this afternoon that you won't allow to be debated would say, let's begin to collect information on the employer side to find out who these employers are, 20 or more employees, not every employer. We know there's some folks that maybe employ half a dozen people. But we know we have some large employers in this state, and I haven't said Walmart today, but let me say Walmart, and other big ones that have people that work for them that are more than happy to have Iowa taxpayers pay for their health care on the Medicaid program. Well, who are they? Why are we letting them freeload? Why aren't we going to have some requirements on them that they help pitch in to pay for the Medicaid program? Your focus was all on the recipient, the freeloader, not on the employer. So we didn't get to see that amendment. I'm sorry we didn't. I think it's time we collect information on the employers of people on the Iowa Health and Wellness Program that hire 20 or more people, but we're not going to be able to vote on that today. A second issue that was presented in the House, back to the taxpayer, because I know you care about the taxpayer. We had the property tax bill. We're being ripped off right now by the pharmacy benefit manager companies. They're overcharging the state Medicaid program. Representative Forbes looked through records that were provided by DHS and compared what the state paid against what and how the transaction went down at the drugstore and what was billed by the pharmacy benefit managers, and discovered its discrepancy. Millions of dollars in discrepancy. The House wanted that, supported that, and we couldn't get it in this bill this afternoon. It's an issue that's not going away. Drug costs continue to go up. It's one of the fastest costs to the Medicaid program, and I don't think any of us want to be taken advantage of as people that are supposed to be paying to what we're doing with the state budget and the resources. But I think that the research that Representative Forbes found is that we've got a problem, and we should have had an audit in this bill. Now, I know that that was looked at. Senator Costello looked at it, and AmeriGroup said it's not a problem. So the language didn't get in the bill. So that would have been, I think, a meaningful amendment to have run this afternoon. But again, because you put this together in the back room, rolled it out here a few hours ago, we don't really, and you're double barreling us, you're preventing us from offering an amendment. We're not going to be able to do that. So one final thing. Senator Costello, earlier you said, when we discussed the provisions in the bill dealing with the civil rights changes on whether or not we're going to support medically necessary procedures for transgender Iowans, I'm going to paraphrase you now, but you basically suggested that taxpayers shouldn't have to pay for those services because they're too expensive or that somehow. I wondered if you would yield and maybe clarify your view on that. I know Senator Wahls asked a little bit about it, but I just want to be clear about your view on that.
Senator Costello, will you yield?
Yes.
Thank you, Senator Costello. Senator Costello, earlier, as I said, we were talking about what criteria you would have on whether or not transgender Iowans who have medically necessary surgical procedures, you were concerned about the cost of those. Could you elaborate more about why that concerns you?
Well, we have limited benefits for, there's certain things we do cover, certain things we don't cover. And I'm just pointing out that this is a rather costly procedure that would have to be a factor we consider in whether we want to do this.
Do you think that that people that need organ transplants that I assume are really expensive, that we should decide on whether or not we're going to support people that need organ transplants under the Medicaid program and have a cost test on that? Do you think that would be appropriate?
I don't know what you're getting at. I guess if the transplant was appropriate and available, I think we should do it.
And if it costs a lot of money, that wouldn't bother you because I think they're pretty expensive. I would guess that they're more expensive than some of these kind of more minor surgical procedures that a transgendered Iowan might want to have.
Certainly, we want to try and help people with the needs they have. Joe, I do not think it's that most taxpayers want to pay for this type of surgery, which you would argue is not elective. Many people would think it was elective.
Right. And how about people with brain injuries that need rehabilitation? Is that something that you'd be okay paying for?
Yes.
and it costs a lot of money for senior citizens on Medicaid in our nursing homes. That's okay. You're okay with that, even though it's probably expensive. It's expensive. One of the more expensive things.
$23.5 million
okay.
toward that.
Thank you, Senator Costello. So the Medicaid program pays for all sorts of things. Some are expensive, really expensive, and some are not. And we just heard Senator Costello describe kind of things that he apparently believes that Iowans think are okay to pay for, and then procedure, medically necessary procedure, maybe a transgender Iowan might need, but people kind of don't like paying for that. So we need this language in the bill. So I'm concerned about that. I think that strikes at kind of unequal service to the people of Iowa that have medical needs. So there are many reasons to vote against this afternoon. The least of which was an awful process. We have the time to go through this in the normal procedure. You blocked the minority from having its voice. We're eating up some time this afternoon running faux amendments because you won't let us actually get votes on amendments. I guess that's what we get to do in the minority this afternoon here in the Iowa Senate. Thank you, Mr. President.
The chair recognizes the senator from Cerro Gordo, Senator Ragan.
Thank you, Mr. President. Ladies and gentlemen of the Senate. Well, you know, Senator Costello, you did something pretty amazing today. I did not think anyone could put that much policy in a human services budget. You have even topped Senator Jack Hatch. I am amazed at that. You know, I have seen lots of bills come through here, and I served as the chair of this at one point, but this tops it. I think you could go back and count policy, and we probably would see on a comparison, you've beaten Jack. Mark that down, and somebody can report that in a year from now. Anyway, the process, you know, we had these wonderful committee meetings downstairs, and half of them we were walking over to a different organization to learn about something we already knew about. But this seems like some of this stuff we should have talked about in our subcommittee. I'm sure that we could have had some discussions. If you didn't like the sex education by Planned Parenthood, maybe we could have talked about that in the subcommittees. You know, if this was not something, if you didn't think that young people should be aware of some of the, you know, the things that go on in the education of how that happens, I just really think that we should have had that brought up in somewhere. The bills that we've seen in this piece of legislation, I serve on the Human Resources Committee that Senator Miller Meeks chairs, and I did not see these bills come through here. Some of them actually didn't move that are on here. I think we have a process, and I've always been a firm believer in that, whether it was with Jack or Senator Hatch or with you. I think this isn't the place to do that. It's a place where we should have full discussion. And I think the changes to the managed care system, these are tweaks. And you know, I think that everybody in the state of Iowa is aware that things are not going okay. A couple years ago, the governor said that we had a few bumps. I think this is getting pretty rocky for a lot of folks. And they're the most vulnerable people. They're not the people that know how to handle all the situations. And it's a tough situation for people when you're talking about health care. We've talked a lot about people's health care here today, and I think it's really important to know that that is something we should all be valuing, is when we have our health, because any one of us could become someone who is on Medicaid. You walk out there and you trip going down those lovely steps, we could all be an example of that happening to us. And that's, you know, something that's reality. People don't desire to be on Medicaid. And we, you know, have done some things in the past. Last year, we did a lot of cost containments to the hospitals. And I don't see us doing anything to change some of those. They're struggling with managed care, and this cost containments are still there. I didn't see any of those addressed. Now that to me is a budget item. This Medicaid system is broken. It impacts providers. We've thrown a little money here and there at trying to help some of the, with tiered rates and those kind of things. And I think that's good. I think that's impressive that we've done that. But there is a whole system that we need to be looking at, a whole system that we should be saying, maybe things aren't going okay. We've got oversight committees, but really the accountability in this piece of legislation isn't there. And when we do an oversight committee, we meet one day, we have people troop in, and it's usually, the managed care corporations that tell us things are good. And we're hearing from constituents all across the state. So I'm disappointed in that. I want to say how proud I am of my fellow Democrats standing over here that got up and spoke about the issues that they weren't able to address in an amendment form, because it shows that they care, and they care about the people that they represent, whether it's children, whether it's seniors, whether it's the disabled community. They care, and that is important to know that your person that's representing you is taking care of the most vulnerable. I hope that the House rejects this. I'm pretty sure it won't. I'm sure that the agreements are pretty much sliding through. But I think that the system should have been more open, more transparent. It's kind of a word we seem to use around here. We just have to practice it. And I hope that next year that we see that this doesn't give us more pregnancies, especially teen pregnancies, because we haven't had the proper sex education in our schools, and that we have not seen more vulnerable Iowans fall through the cracks because we haven't tweaked or at least fixed the Medicare system. I hope that we see a lot of successes, but I'm not that optimistic, and I'm disappointed, and I urge a no vote on this piece of legislation.
Seeing no further discussion, the chair recognizes the chair from Mills, Senator Costello, for final remarks on Amendment 3201 as amended to House File 766.
I just asked to move the amendment, please.
The senator from Mills, Senator Costello, moves the adoption of Amendment 3201 as amended to House File 766. Those in favor say yea. Yea. Those opposed say no. The yeas appear to have it. The yeas do have it. The amendment is adopted. That disposes of all the amendments. We are now back on House File 766 as amended. Is there any further discussion on House File 766 as amended? Seeing none, the chair recognizes the senator from Mills, Senator Costello, for final remarks on House File 766 as amended.
Thank you, Mr. President. I thank you for participating in this debate. I do want to address a couple of things that were brought up. As far as the sexual education, we are not getting rid of the program. We're just making it so abortion providers cannot participate in that program. So we do continue that program. And also the Forbes amendment that went on in the House, I have some notes from the Department of DHS. They took his concerns very seriously. They met with him numerous times on the issue. Or last year, they gave him lots of responses on this issue. Director Randall does not believe that spread pricing, which is what he talks about, is an issue in the Iowa Medicaid program. And Director Randall has taken actions to ensure that spread pricing is not an issue in the Iowa Medicaid program. And so they do not have concerns with that. And the way that we compensate and set our Medicaid cap rates would not be affected by the way that this was calculated. So it's a very complicated thing, and I'd be happy to share it with you individually, maybe more detail so I can explain it at more length. But I just I did look into that. I took it seriously. I talked to the to a lot of people about it, and I just really don't think that audit is necessary. The only outcome that might come from that, and I don't think it really would be that the PBMs would have to pay the managed care companies a little bit more. It would never come back to us. So with that, I'll go ahead and do my prepared remarks here for the end. This state funding for education is 55.6% of the state budget. The next biggest piece of the state budget is HHS at over 25% of our state budget. And while no amount of money is ever going to be enough to satisfy everything that we want, this is a lot of money. And I want the taxpayers to know that I do consider this their money, and when I spend it, I want to spend it wisely. I don't want to waste it, and I want to spend it for good things. I think the things that we're spending this money on are good things, and they're helping a lot of people, and I just want to indicate that. So some of the things we've done, just to recap, the Medicaid pilot project to get people out of an institution back in their homes, funding for children's mental health, funding to rebase our nursing homes to make sure they can continue to stay in business and care for our elderly. We provide increased funding for our critical access hospitals and for assertive community treatment. We also make sure we continue to fund Hawkeye, even in light of shrinking federal resources for the program. We provide more money for child care providers and security and support staff at our DHS institutions. We also provide funding to support and provide additional assistance to low-income Iowans out in the field. Our bill asks DHS to seek a waiver to provide Medicaid coverage for pregnant women lawfully admitted for permanent residence in the United States without application in the 5-year waiting period. So there's also the things that we, as the Iowa Senate Republicans and the Republicans in the House and the governor have been trying to listen to the needs of the providers as regards to Medicaid. And so we've got the pre-auth forms. We're trying to get them all uniform. That's a problem that we've heard. We've heard about people not getting their payments and claims in a timely manner. So in addition to the 2% that we can withhold if the MCOs are not meeting those goals, we're going to allow for liquidated damages. This is going to be a powerful incentive for them to take care of that problem, as well as the credentialing. If they don't get credentialing done in a timely manner, they can be assessed liquidated damages. So we are trying to listen and trying to take some action that will make a difference. We did hear in some of our meetings, we talked about that they have been doing things, and Senator Ragan and Senator Bolkcom, you were there, and they have been doing some changes to Medicaid to try and address some of the difficulties we've had. And so I think we're continuing to work on that and try and make progress. So I do want to thank Senator Bolkcom and Senator Ragan for working with me this year. We had some things we talked about, some of your suggestions I took to heart, and we actually did. We changed some of the things that were in the House that you didn't think were good, and I agreed with you, and I'm glad that we were able to talk and have those discussions. I've appreciated that you're working with me and talking with me. So it hasn't been bad all year, that's for sure. It's been a good year. I also especially want to thank Senator Miller Meeks and Senator Edler is there on the committee with us as well. Particular Senator Edler has helped me in a number of ways and done research, and we've worked out some of these things. So I really appreciate the work that he's done. You know, we deal with some tough issues. They're things that we get passionate about, and we know that this budget directly impacts the lives of some of the most vulnerable Iowans in this state, and we do have a finite amount of money, and we try and prioritize that as best we can. And I also want to not forget to thank the LSA staff, Jeff Benson and Kent Holmes. They help us get the numbers together, and Patty Funaro from LSA did most of the drafting, and she works really hard at that and does a great job. I want to thank Chris Bell from the Senate Democrats and our own staff, Josh Bronsick and Russ Trimble. There's a lot of work that goes into this, and I really am appreciative of everybody that helps me get this together, and I want to thank you for the help that I've had. And with that, I would Move that the bill be read for last time and placed on its passage.
The senator from Mills moves that House File 766 as amended be read for the last time and placed on its passage. Those in favor of the motion say yea. Those opposed say no. The motion prevails. The secretary will read.
House File 766, a bill for enacting relating appropriations of health and human service veterans, including other related provisions, appropriations providing penalties, including effective date and retroactive other applicability date provisions being enacted by the General Assembly State of Iowa.
The senator from Mills moves that the reading thus far be considered the last reading of the bill. Those in favor of the motion say yea. Those opposed say no. The motion prevails. Is the title agreed to? Yes. The title is agreed to. The question now is, shall the bill pass? Those in favor of the passage of House File 766 as amended will vote yea. Those opposed will vote no. The secretary will receive your vote. Senator Chapman votes yea. Senator Schultz votes yea. Senator Sinclair votes yea. Senator Kornbach votes no. Senator Knoyer votes yea. Senator Feenstra votes yea. Senator Celsi votes no. Has every senator voted? Every senator has voted. The secretary will close the voting system. The secretary will lock the voting system and record your votes. The Senate will pay attention to the result of the roll call. Those voting yea, 31. Those voting no, 19. The bill, having received a constitutional majority, is declared to have passed the Senate, and the title was agreed to.